Good morning. My name is Nana Kofi Kwache, and I'm the Acting Country Director of Aurum Institute Ghana. This morning, the organization is making a donation to the Ghana West District to support their activities and efforts in curbing and addressing the scourge of TB in the country. We, as a partner to the National Tuberculosis Program and to the private sector case finding partners, are happy to make this donation to support not just this immediate World TB Day, but also mobilization around the district in support of case finding, contact tracing, and treatment initiation for TB clients.
So much for joining us here for our issue this morning. As you know, we've been long-term partners in this fight against TB. This World TB Day, we wanted to commemorate the day by sharing with you some of the resources that we have to combat this disease. We're making a donation of not just PPEs and disposables that you can use in the work. We're also happy to support this year with some additional funding to mobilize your vehicles and staff to the field for contact tracing, for sensitization, and all that. So we're very glad to make this donation and look forward to our continued collaboration in this effort.
My name is Richard Peter Yali. I am the Municipal Tuberculosis Coordinator at Ghana West Municipal Health Directorate, supervising all TB cases within the municipality and then putting them on treatment. I've done this job for over a year, and today I'm so happy to receive these items on behalf of the Municipal Health Directorate from Aurum Institute, Ghana. These items will go a long way to support our activity, especially when it comes to our private facilities case finding. We have about 5 health facilities within the municipality that are private facilities supporting Aurum Institute case finding. And this is one of the items we use to motivate the staff and then the facility to be able to get a lot of cases for us. Last year, by their support, we were able to do 70% of our case search within the Greater Accra region. And I'm so happy that today, this year too, we have received another donation from Aurum Institute to boost our morale and also to support in finding the TB cases. All these items are going to be useful, especially when it comes to tuberculosis case management. We need these items to protect ourselves. The PPEs, the A4 sheet, we do a lot of printing, we do a lot of letter writing, a lot of, going up and down, support for full movement. We do a lot of movement activities. So these items are really in need, and thankfully today we have gotten some of these items. We are going to make good use of it to be able to provide quality services to our patients who are affected by the TB diseases. And so I want to say thank you to Aurum Institute. I want to say thank you to the directors, thank you to the staff. I want to say thank you to the program manager for the support. When we brought the request that we need these items in commemorating World TB Day, they didn't deny us. They have really provided us. And today, I am so shocked, I am so surprised to receive this item, because out of the lot of letters I sent out, Aurum has come to be a support to the Municipal Health Directorate. And so I want to say thank you. Aurum, God bless you. We pray that you get more funding for all other activities, so that when anytime we reach your door, you can support us adequately. Thank you so much.
Thank you. Open the t-shirts. Yes.
This year theme says that we need to commit, we need to invest, we need to deliver. And this is one of the commitments Aurum has done.
Aurum Institute is a proudly African health impact organization that has been working around the continent for the last 27 years to generate evidence for policy and help translate that policy into practice in the field of health sciences research, in the field of health service implementation, and also clinical trials and basic sciences research. We are headquartered in Johannesburg, South Africa, and since that is our headquarters, a lot of the focus for us has been on TB and HIV historically. For the last 8 years, we've been working in Ghana as well, obviously pursuing those traditional interests of TB and HIV. But in more recent times, we've also diversified our portfolio to support the country's response to antimicrobial resistance, and also investing in innovations in artificial intelligence for health service delivery. You all know one of the core challenges with the TB case finding in the country is that historically it's been really limited to the public sector. What we are trying to do in collaboration with the National Tuberculosis Program with the generous funding of the Global Fund, is to expand that case finding efforts into the private sector. We believe that if we can bring on board the private sector, which caters to a significant proportion of the population on an annual basis, if we can bring them on board into TB case finding efforts, then we have a better chance at finding the missing cases that historically we have continued to miss. In doing this, it's necessary to make sure that private sector facilities and partners have the right training, have the right equipment, and also are integrated into the broader public health response for TB, making sure, for example, that the staff at those facilities receive the same kind of training in risk communication, in patient management, in risk identification, in patient follow-up that many of our colleagues in the public sector receive. And for us, in doing that, we are cognizant of some of the existing challenges in the private sector, the high attrition rates among staff, sometimes the challenge that they have in identifying or procuring all the reagents and consumables and equipment that they need to really support the response. So integrated into our work is making sure that we are doing constant support supervision, making sure that we're understanding the challenges on the ground as they emerge, and working with the regional and district directorates to address them. And then obviously we're also supporting a number of these facilities we partner with in the private sector with laboratory equipment, specifically gene expert machines that support biological testing or genetic testing for the actual underlying tuberculosis infection. And what that allows us to do is to not only bring them on board for the case finding in terms of screening, but equip them to actually do the confirmatory testing as well. Knowing that not all the facilities can get some of those equipment, we've basically created hubs and spokes, where at the hub facilities we have the testing packages available in addition to screening, and networking those spoke facilities for confirmatory testing at those hubs. I think the theme of this year's World TB Day speaks significantly to that. We have to be more committed in the fight, and that doesn't only mean healthcare workers in the front line. It means greater political commitment from political decision makers, greater commitment and investment and engagement with the issue by our community leaders as well, our religious and traditional leaders. So we know commitment is one key component to that. We also need to see much greater investment in the area of the TB response. Currently, a significant part of our national TB response is supported by international development assistance, largely through the Global Fund. But as we look to localize and have greater ownership of that response, it's critical that there is some additional dedicated funding from the government to make sure that as Global Fund also transitions out of the picture, the government of Ghana, the Ministry of Health, the Ghana Health Service are in a position to continue the response at the level that it already exists, and then to invest in looking at new innovations in testing, new innovations in treatment, and looking at how we can bring those to bear in our response as quickly as possible for the lowest cost and the most efficient ways as possible as well. Finally, we have to make sure that we're actually delivering, that we're bringing to bear these investments, this political commitment, and not just having them translate into white elephant projects, but specifically to see those manifest in increased case finding in the private sector and overall greater performance in Ghana's efforts to identify the missing cases. We can eradicate TB, and that comes down to our efforts to prevent TB. If we want to eradicate TB, then we have to prevent it. That's why in doing these screenings, we're not only focused on the clients who we may identify as having having TB disease. We're also interested in the contacts with those individuals, their families, people they work with, so that we can understand their risk and initiate them on the medications we now have available to prevent a potential TB exposure from becoming TB disease. If we are more invested in that effort, if we are more committed to that effort, and we're actually able to deliver on supplying that TB preventive therapy, identifying people at risk for it, and really focusing the effort in that regard, eventually we stand a very good chance of eradicating TB from Ghana.
Aurum Institute Ghana, we are known for TB work, and in the past, under TB Rich wave 6, we did a private sector work, which also led us into this work that we are currently doing, known as the Public-Private Mix Initiative under the Global Fund Cycle 7 project. This work, we are looking for the TB cases in the private sector in selected private facilities and over-the-counter medicine shops and pharmacies in 4 selected regions in Ghana. And these regions are Ashanti region, Northern region, Western region, and Greater Accra. Currently, we are working with the regional and district health management team in this regard, and also a civil society organization known as TB Rich. We also work with the support of Professional Health Association. With this work, we've been able to train 375 health workers in the private sector. Again, we've been also able to train 37 TB champions. These TB champions are recovered TB clients who support us in screening activities in the pharmacies and over-the-counter medicine shops. What they do is that they support the pharmacies and over-the-counter medicine shops in screening people who enter the shop to buy cough mixtures, and also transport samples of presumed cases into gene expert sites, and also follow up to take results and refer clients who are positive into treatment. They also do contact tracing to ensure that contacts of those who are confirmed positive are also initiated into preventive treatment. Through this initiative, we've been able to install gene expert machines in 20 selected facilities which otherwise did not have these machines in the private facilities. Again, with the help of this initiative, we've been able to also provide logistics and technical support in the private sector to be able to provide TB services in line with the national protocols. With this initiative, last year, 2024, we were able to diagnose 602 cases, and this was able to contribute to 3% of the national TB case findings that were identified in Ghana. The major challenge that we have in implementing TB case finding in the private sector is the high staff attrition that we have. But we found a mitigation measure to this bottleneck. What we do is that we go on continuous supportive supervision, and through that we provide on-site supportive coaching to new staff who are employed by these private facilities. This is not different from what we do experience in the public facilities. However, it is high in the private facilities more than the public facility. We are committed to support in ending TB by 2030 as a country, and we will continue in our efforts to do so by expanding our scope in the near future to major private health facilities and over-the-counter medicine shops as well as pharmacies around the country.